So utilizing a different body, a different person, one of the things that we're going to try to show is how patient active approaches with respect to relational motion, so one thing staying still, one thing moving in relation to it, and not using the standard approach of contract the area that you're working on or the joint space that you're working on. One of the things we can do really quickly is look at an elbow. So with a previous example that you'll see on the channel, you'll see that it was most appropriate for that particular individual to contract the region around the elbow. Whereas in this case, we may find something where if we search different activating forces, we'll see something different. So quick, simple assessment. Will not open all the way, but that's okay. Somewhat of an issue with closing. So if we look at the joint space and what's going to happen, we're going to have a still forearm moving everything else, and we're going to search to see what ends up happening, okay? So about barrier there. Push your wrist into my hand. Good, and let it relax. Okay, so we get something there. So again, we look at the joint space and see what happens. I want you to tip forwards. That closes the joint space quite well and come back to a neutral position, and I don't let anything off. So that works. Twist your torso away from me. As he twists his torso away from me, we get the elbow to close a little bit more, even though it's at soft tissue approximation. Come back to the middle. Twist towards me. And that just kind of pulls everything away from me, so that doesn't work. All right, now what I want you to do is try to tip away from me just to see. And interestingly enough, that closed the joint a little bit, didn't it? Unexpected. So the important part is to look at that we can search for alternate movements where we don't activate the area so we maintain comfort, but we still utilize the concept of relational motion and a patient active approach where we don't necessarily contract the area. The one that was probably the most comfortable and most impactful for you was when you twisted away, correct? Yeah, fair enough. We got some agreement. Mikey likes it. Good on you.